Hello guys, we're going to discuss about the blood transfusion. And now, what is blood transfusion? Blood transfusion, introduction of blood or its component directly into the circulatory system. Second definition, transfusion of the blood or its component such as blood cell or plasma from one person to another person. Okay. Blood transfusion purposes. What is the purposes of blood transfusion? Number 1, to restore the blood volume when there is sudden loss of blood due to hemorrhage. Second, to raise the hemoglobin level in cases of severe anemia. Third, to treat the deficiency of plasma, protein, clotting factor, and hemophilic globulin. Next, to provide antibodies to those persons who are risk and having lowered immunity. Next, to replace the blood with hemolytic agent with the fresh blood, and also to improve the leukocyte count blood as agranulocytosis. Okay, what is the components of blood? The components of blood, each unit of blood is tested for evidence of hepatitis B, hepatitis C, human immunodeficiency virus 1 and 2, and also the syphilis. Component also, the blood is in the processed into subcomponent. These are: number 1 is the whole blood. Number 2, packed cell volume. Third one, fresh frozen plasma, and the fourth one is platelet. Next, we're going to discuss about the whole blood first. The whole blood, what is the whole blood? Whole blood is the unseparated blood containing an anticoagulant preservative solution. Next, 1 unit of whole blood contains 450 of donor blood, 50 ml of anticoagulant preservative solution. Next is hemoglobin, approximately 12 g per ml, and hematocrit 35% to 45%. No functional platelet. And then whole blood is started within 30 minutes of removal from refrigerator and completed with 4 hours commencement, because the changes is composition may occur due to red cell metabolism. Okay, pagkakuha po natin sa refrigerator, 30 minutes po ay kinakailangan po natin maihook agad sa pasyente. Okay, and then also yung during the blood transfusion, na kukonsume po ang whole blood within 4 hours. Next, packed red cell. Yung packed red cell natin are cells that are spun down and concentrated. 1 unit of packed RBC is approximately 350 ml and has hematocrit of 50 to 70%. They are stored in saline glucose mannitol solution to increase the cell life to 5 weeks to 2 to 6 degrees centigrade. Next, and then also the fresh frozen plasma. The fresh frozen plasma is rich in coagulation factor, and also it is separated from the whole blood and stored at -40 to -50 degrees concentrated or concentrate with a 2 years shelf life. It is the first line of therapy in the treatment of coagulopathic hemorrhage. Next, we're going to discuss about also the blood transfusion involves the 2 procedure. Ano ba yung 2 procedure for blood transfusion? Number 1 is collecting of blood from the donor. Number 2, administration of blood to the recipient. Next, we're going to discuss about the blood grouping and the cross-matching. Pag sinabi natin blood grouping and cross-matching, each person has one of the following blood type. Meron tayong blood type A, blood type B, blood type AB, or type O. O can be given to anyone but can only receive O. And AB can receive any type but can only be given to AB. Also, every person blood is either RH positive or RH negative. Okay. Now, we're going to discuss also the type A. What is type A? Type A has antigen and has anti-B antibodies. Next, type B has B antigen and has anti-A antibodies. Pag sinabi natin type AB has both A and B antigen, has no A or B antibodies, and also called universal recipient. Pag sinabi natin ano daw po yung universal recipient, type AB. Next, type O has no A or B antigen, has both A and B antibodies. Type O is also called universal donor. Pag type AB, universal recipient. Okay, wag malilito. Ang O, ayan ay universal donor. Universal recipient, type AB. Okay, now, we're going to discuss also the nursing intervention for blood transfusion. What is the nursing intervention? First of all, we need to verify the doctor's order. Then inform the client and explain the purpose of the procedure. The most important, to verify the doctor's order. Make it sure na meron po tayong doctor's order bago po tayo mag-blood transfusion. And then pag magba-blood transfusion po tayo, make it sure na explain sa pasyente or sa client kung ano ang dapat gagawing procedure sa kanya. And also, the most important is consent. Ang consent po ang kinakailangan para po makapag-start tayo ng blood transfusion. Kasi, ayan po unang for documentation, importante po ang consent ng pasyente para po malaman natin kung pumapayag po siya na magpasalin ng dugo. Then number 2, check for the cross-matching and typing. Okay, as a nurse, kinakailangan po natin mag-send ng request sa laboratory for cross-matching and typing ng blood para mas ensure po natin ang compatibility ng blood. Okay, number 3, obtain and record baseline vital sign. Bago po natin start ang blood transfusion, meron po tayong kinakailangan na vital sign as your baseline. Next, at least 2 licensed nurse check the label of the blood transfusion. 2 pong nurses ang magche-check po ng label ng blood na blood transfusion natin. Ano po ba yung mga dapat i-check ng mga nurse sa blood transfusion? Unang-una is serial number. Number 2, blood type. Number 3, blood component. Number 4, RH factor. And last is the expiration date of the blood. Yan po yung chine-check ng 2 licensed nurse ang label ng blood transfusion bago po i-transfuse sa pasyente. Next, number 6, warm the blood at room temperature before transfusion to prevent the chills. Okay, kailangan po ang nasa room temperature ang ating blood para ma-prevent po natin ang chills ng pasyente. Number 7, identify the client properly. Of course, you need to identify the client properly. Bakit? Kinakailangan mo malaman kung talagang yun ang pasyente ang pagbibigyan mo ng blood transfusion. Bale, 2 nurses din po ang mag-check ng client identification. You need to ask the patient, can you tell me what is your full name? ask nyo sa pasyente, sabihin niya sa inyo kung ano yung buong pangalan niya, and then check po the armband ng pasyente. And then, ang ginagamit po natin, number 8, ang ginagamit po nating gauge is gauge 18 and 19 para po easily flow of blood. Malaki po ang needle ng 18 at saka po ng 20 gauge for the blood needle. Number 9, use the BT set with a special micron mesh filter to prevent administration of blood clots and particles. Okay, magkaiba po yung normal line o yung IV set line at saka po nung BT set. Ang BT set po ay makikita ninyong may filter. Yung pong may filter, yung po ay BT set. Yung normal line po, wala po siyang filter. Okay, number 10, start the infusion slowly at 10 drops per minute. Remain at bedside for 15 minutes to 30 minutes. Adverse reaction usually occurs during the first 15 to 20 minutes. Okay, pag nag-start po tayo ng BT sa pasyente, kinakailangan po natin nasa bedside po tayo or mananatili po tayo sa bedside ng 15 to 30 minutes para po ma-observe po natin yung blood transfusion reaction. Ang blood transfusion reaction, nag-occurs po siya within 15 to 20 minutes during the blood transfusion. Okay, nasa bedside po tayo 15 to 30 minutes para po natin ma-check ang adverse reaction ng blood transfusion. Number 11, monitor the vital signs. Of course, we need to monitor the vital signs of the patient before, during, and also after the blood transfusion. Okay, alter the vital sign indicate adverse reaction. Okay, pag increase ang temperature at increase ang respiratory rate, what are you going to do? You need to stop the blood transfusion. Pag nag-increase ang temperature ng pasyente at nag-increase ang respiratory rate, ang kinakailangan po natin na gawin as a nursing intervention is stop the blood transfusion. Next, number 12, do not mix medication with blood transfusion to prevent adverse effect. Do not incorporate medication into the blood transfusion. And do not use blood transfusion line for IV push of medication. Okay, yung pong line po natin para sa blood transfusion, ayun po ay para sa blood lang. Hindi po natin pwede mag-incorporate or mag-IV push gamit po yung BT line ng medication. Hindi po tayo pwede mag-incorporate, hindi po pwede po tayo mag-mix, hindi din po tayo pwede mag-push ng IV medication sa BT line. Number 13, administer the 0.9 sodium chloride before, during, and after blood transfusion. And then administer IV fluids with dextrose. Never administer the IV fluid with dextrose. Okay, administer daw po tayo ng 0.9 sodium chloride. Yung sodium chloride po, before po nagbikukan po tayo para ma-prime po natin yon. Ipa-prime muna po natin yung line ng BT line by using of 0.9 sodium chloride. And then after ng blood transfusion, ihuhook po natin yung sodium chloride. Huwag po tayo mag-a-administer ng fluid na may dextrose. Bakit po? Kasi kapag po tayo ay naglagay ng gumamit ng or mag-administer ng IV na may dextrose, ay magkakaroon po tayo ng fluid cause ng hemolysis. Kaya po kinakailangan natin ay sodium chloride lang. Bawal tayo maglagay na may IV na may dextrose kasi nagkokos siya ng hemolysis. Okay, number 14. Number 14, administer the blood transfusion for 4 hours. Okay, ina-administer po natin o kino-consume po natin ang blood transfusion within 4 hours. Whole blood, pack RBC. Ang plasma po at platelets, nagtatransfuse po natin siya ng quickly, 20 minutes. Clotting factor can easily be destroyed. O kung magkaiba po yun, pag 4 hours po ang administration ng blood transfusion, whole blood po at saka pack RBC. Pag plasma at platelets ang itatransfuse, quickly lang po ang pagtatransfuse niya within 20 minutes. Okay. And then also observe the potential complication. Kapag po tayo nag-hook ng blood, observe po natin yung complication ng pasyente o yung mga reaction. Magkaroon po tayo ng blood transfusion reaction, ano po kinakailangan natin? Stop the blood transfusion, and also you need to notify the physician. Next, and then after that, we're going to discuss also the complication. What is the complication of blood transfusion? Okay, number 1 complication is allergic reaction. Ano po ba yung allergic reaction? Allergic reaction, it caused by sensitive to plasma protein of donor antibody which react with recipient antigen. Ano po yung kinakailangan nating assess para sa mga allergic reaction? First is flushing, rashes, pruritus, laryngeal edema, and difficulty of breathing. Alin man po dito sa na-assess natin at nag-complain ang pasyente, nakita natin nag-flushing, nagkaroon siya ng rashes, nagkaroon ng pruritus, nagkaroon ng edema, nag-complain ng difficulty of breathing. Ano po ayan? Tinatawag po natin yan na allergic reaction. Nagkaroon ng allergic reaction ng pasyente, anong ginagawa? Stop the blood transfusion. And then, next is documentation. And then after documentation, inform the attending physician. Next is febrile and non-hemolytic reaction. What is the febrile and non-hemolytic? It caused by hypersensitivity to donor white cell, platelets, or plasma protein. This is the most symptomatic complication of blood transfusion. Ano po yung kinakailangan natin i-assess para malaman po natin ang febrile or non-hemolytic reaction? Sudden chills and fever. Next is flushing. Next, headache. And then, anxiety. Ano man po dito na na-assess natin at pumatak po dito sa 4 na to, ibig sabihin po yan ay febrile and non-hemolytic reaction. Next is septic reaction. Pag sinabi naman po nating septic reaction, it caused by transfusion of blood components contaminated with bacteria. Ano po yung mga ina-assess natin? First is rapid onset of chills. Yan, nag-chills pa din po ang pasyente. Next, nagsusuka, vomiting, mark ng hypotension, and nagkakaroon siya ng high fever. Ano man po makita natin dito sa 4, possible po ang pasyente ay mayroong septic reaction. Next is circulatory overload. Pag sinabi natin circulatory overload, it caused by administration of blood volume or rate greater than circulatory system can accommodate. What is the assessment? Ano po yung i-assess natin? First is the rise of venous pressure, dyspnea, crackles or rails, and then distended na neck vein, then nagkakaf ang pasyente, and then nagkaroon siya ng elevated blood pressure. Pag nakita nyo po yan, ayan po ay circulatory overload. Next is hemolytic reaction. Ano po yung hemolytic reaction? Hemolytic reaction, it can cause by infusion of incompatibility blood products. Ano po yung ina-assess natin sa hemolytic reaction? The first sign of hemolytic reaction, nagkakaroon po ang pasyente ng low back pain. Pag nagkaroon ng low back pain, ayan po ay hemolytic reaction. Hemolytic reaction, yung low back pain is the first sign. This is due to inflammatory response of kidney to incompatible blood. Ano po yung kinakailangan pa natin assess? Bukod sa low back pain, nagkaroon din ng chills, feeling of fullness, tachycardia, flushing, tachypnea, hypotension, bleeding, vascular collapse, and acute renal failure. Yan po yung mga hemolytic reaction. Don't forget, pag nagkaroon ng low back pain, that is the first sign of inflammatory response of the kidney, incompatible reaction ng blood. Ayan po tinatawag nating hemolytic reaction. Next, we're going to proceed in the nursing intervention of blood transfusion. What is the nursing intervention? Number 1, if blood transfusion reaction occurs. Okay, so sa lahat na nabanggit natin, nagkaroon ng transfusion reaction, what are you going to do as a nurse? Of course, you need to stop the transfusion. Immediately stop the transfusion. The second one, start the IV line ng 0.9 sodium chloride. Bakit daw hindi natin kailangan magbigay ng line or ng IV na may dextrose para nagkakaroon ng cause ng hemolysis. Okay, number 3, kaya ang ginagamit natin ay sodium chloride. Okay, place the client in a polar position if the shortness of breath and the administer of autotherapy. Okay, pag nagkaroon po tayo ng blood transfusion reaction, ano po unang gagawin? Stop the transfusion. Pangalawa ay position the start ng IV, mag-hook ng IV line, and then stop mo yung then ang pasyente ay kinakailangan mong i-position. What position ang kinakailangan sa pasyente? Naka-Fowler's position. Kapag nagkaroon ng shortness of breath, kinakailangan natin magbigay ng O2, oxygen. Number 4, the nurse remains with the client, observing the signs and symptoms and monitoring the vital signs as often as every 5 minutes. Okay, imo-monitor natin ang pasyente for sign and symptoms ng mga reaction. Within, ang vital sign natin, imo-monitor natin ng vital signs every 5 minutes. Then after that, we need to notify the attending physician. Notify the attending physician. Number 6, the nurse prepare the administer emergency drugs such as antihistamine, vasopressor, fluids, and steroid as per physician order. Okay, meron po tayong ipiprepare na mga emergency drug. Yung mga antihistamine, vasopressor, fluids, and steroids as per physician order. Kinakailangan po natin bago tayo magbigay ng mga gamot na yan, make it sure ay may order ng doktor. Hindi po tayo pwede magbigay ng mga antihistamine, vasopressor, fluid, and steroid kung wala pong order ang attending physician. Next, number 7, obtain the urine specimen and send to the laboratory to determine the presence of hemoglobin as a result of RBC hemolysis. Yan. Kinakailangan po natin ng urine specimen. Isasubmit po natin yan or isesend sa laboratory para malaman po natin yung presence ng hemoglobin as a result of red blood cell hemolysis. Number 8, blood container tubing attached, label the transfusion record, are saved and returned to the laboratory for analysis. Okay. That is the nursing intervention ng blood transfusion. The most important, make it sure, itatanong nyo muna or ask nyo muna yung pasyente ano ang relihiyon niya. Importante pong maitanong natin kung ano ang relihiyon ng pasyente. Bakit? Kasi po meron po mga relihiyon na hindi po tumatanggap ng blood transfusion. Kaya kapag ganun po, irespeto po natin. And then also, the important is the consent of the patient. Kinakailangan po natin na hingian siya ng consent na pumapayag siya na magpa-blood transfusion. Bali po, yan po ang discussion mula sa blood transfusion. Sana po nag-enjoy kayo or na meron kayong natutunan about blood transfusion.